welcome back to Jenny Dance Physio channel. Today we are going to move on to the shoulder anatomy part 2. So last time we did talk about, for a shoulder, we have 3 bones. So look at the big model here. Shoulder composed of a scapula, humerus, and then a clavicle. So these 3 bones actually form 5 different accessory joints. So last time we did learn that the scapula and the thoracic form a scapulothoracic joint. So the scapula actually will move along the chest wall. So there are 6 different movements. So last time we already talked about the 6 different movements. So you have already learned scapulothoracic joint. And then the second joint, obviously, the ball and socket joint. So this is called a glenohumeral joint. GH joint in short. So it's a ball and socket joint. It makes most of the shoulder movement. And then, as we said before, clavicle is also one part of the shoulder. So clavicle will form a joint here with the sternum, sternoclavicle joint. And then the other joint at the other end of the clavicle form a AC joint, acromioclavicle joint, AC joint. And then one last thing is the AH joint, acromiohumeral joint. So if we zoom closer to the shoulder, this is the scapula, and then this is the spine of scapula, and then come out to here. This is called acromion. Acromion form a joint with the humerus, so this is the acromiohumeral joint, AH joint. So there is a gap in between this area. This is not a physiological joint, this is not a real joint, but it is an accessory joint which is in between these 2 bones. So it's not an actual joint, but the adjacent surface between the 2 bones. So in this video clip, we have learned all the 5 accessory joints inside a shoulder. Please give me a thumbs up if you like this video. Subscribe to my channel. If you have any question, please feel free to leave me a message at my website www.perfectpoint.com.hk.